Healthcare workers have bravely battled through 2 waves of COVID-19. They've worked grueling hours and saved countless lives, all the while risking infection. They've shouldered the devastation of the tens of thousands of lives lost. We are grateful for what they do, but most of us don't know what the closed world of hospitals during this time is really like. So Dr. Richard van Zyl-Smit is a pulmonologist working in the COVID-19 ICU ward at Groote Schuur Hospital, and he joins us now. Thank you very much for your time, Doctor, especially seeing that you're on call at the moment and taking time away from patients while someone else covers the wards to speak to us. Give us a sense of what it's like working in the ICU wards and the conditions or the situation that most of your patients face.
Yeah, Annie, thanks. It's a great opportunity to be able to share some insights. I think we're all grateful at the moment that the pressure has decreased, but certainly this wave has been brutal like the first wave was. We've expanded our services dramatically at Groote Schuur like many other services has. I can only speak for our service, but we went from a 8-bedded team essentially up to 32. So we instead of running 2 ICU teams, we were running 4 ICU teams. And every single person in that ICU is extremely sick, on ventilators, requiring high levels of oxygen, ventilatory support, on a knife edge for most days. And the real challenge for us, I think, in the COVID times is that the unpredictability of this disease. We have young patients who would come in and we think they're going to do well, and then they crash and die on us. And so I think that, in addition to the pressure of needing to admit patients as fast as we can, really makes it very different from anything that anybody has ever experienced in this hospital or any hospital in this country.
You had a really bad week during the second wave where 13 of your patients died in just 1 week. I can't imagine the kind of pressure that you and your colleagues face. How do you overcome that kind of pressure or get through it? And how do you communicate the loss of loved ones to families who haven't been able to see these loved ones while they've been in ICU?
Yeah, I think each of us deals with it differently. I've been doing this for a while, so I think I'm probably a little bit more hardened than some of my junior staff. But even those of us that are senior have really struggled with the loss of life and the frequency with it. We've had to get very creative in terms of our ability to communicate with patients. So we've often done video calls with family who aren't able to come into the hospital, to explain to them, to show them their loved one on a ventilator, which is traumatic. But obviously with the COVID restrictions, allowing them into the ICUs has not been possible. So communication has been difficult, but we have on a daily basis made sure that every family is updated as much as we can to try and communicate with families and explain to them. But the conversation each day of they are critically ill and unstable, and we're hoping for the best, I assume wears fairly thin over a couple of days, but that's the reality. And for the families, the devastation of hearing that phone call about their loved one having passed away is extremely traumatic. I think for us in the ICU, particularly that week, there was so much going on and so many patients dying so frequently that you also then needing patients to be admitted that we don't think about it. We just, in a sense, keep going because there's no alternative.
At some point, you have to stop, though. You can't just keep on going indefinitely. Throughout the pandemic, you've been writing down your thoughts and experiences in this book that you've published called Thoughts on a Saturday Morning. And very early on in the book, you say that PMP, personal mental protection, is just as important as PPE. What's been your personal mental protection?
Yeah, the mental protection side is critically important. A healthcare worker is needed to look after the sick, and if we don't look after ourselves, we aren't able to look after those that need our help. We've all had little our own sort of approaches. Our team has become very tightly knit, and we have coffee with each other each morning. We laugh, we cry, we talk. And so I think the team that we're working together with, both nurses and doctors, have really supported each other as much as we can. We try and give each other time off where it's possible, so that when you're on, you're working, but if possible, you can be off. And then it's time to do what you do. I paint, I draw, I crochet, of all things, exercise. That's what keeps me going in my time off. I spend time with my family and my kids. And for each of us, that time away from the hospital is critically important. What we did find, though, unfortunately, was deep into the second wave that we were getting to the end of our ability to look after ourselves and each other. And we were heavily reliant on friends and family and support from within the hospital to debrief and, in a sense, to keep us going, knowing that it would end. But when you're doing this week in, week out for a month or two on end, it does take its toll, unfortunately.
We're seeing numbers decrease steadily at the moment, but unfortunately the bad news and the bigger long-term picture is that we're very likely to see a third wave and even a fourth wave before we start seeing any real impact from vaccination rollout. Are you going to have enough time, do you think, to regain some strength and some mental and emotional resilience before the next wave hits?
It depends when the next wave comes. We certainly saw it from the feelings around wave one was sort of an expectant, excited nervousness. Wave two was very much, in the book I write about the DJs playing and no one wants to dance kind of vibe at a party, where we actually don't want to go through this again. I think we're going to have that same feeling when wave three comes. Our hospital's been pretty generous in really trying to slowly get back to normal rather than pushing everyone straight back into their normal services, so that we do have some time to recover. But this is a long-term trauma. It's going to come out over years, I think. The emotional trauma that doctors and nurses are facing, seeing this volume of young, sick patients every single day, really is exhausting. And yeah, I think we need to take our time. We need to realize that this is not normal. And it's one of the challenges that we face, is the disconnect between how we're feeling and what's going on in society and in community, and to communicate that it is tough for us, and we realize it's tough for people out there, but we are all in this together.
That's absolutely right. We are all in this together, but unfortunately some people want to take themselves out of the equation due to vaccine hesitancy. Frontline healthcare workers would absolutely bear the brunt of that kind of impact if more people, lots of people, refused to take the vaccine once it is available. What's your message to South Africans?
Yeah, we are in this together, and I think we need to look after each other. I think that time for selfishness is long gone, and to realize that your actions impact me, my actions impact you. And if we play together on this, if we look after each other, if we take responsibility for ourselves and for other people's health, we will get through this. But all it needs is a couple of parties, a few people that aren't taking the vaccine that then infect others, who then infect others, and we're back into a third and fourth wave. And that's really is the challenge. It's the carelessness of individuals who then impacts on the greater community. And yes, the reality is that 93% or whatever the number was of people will survive COVID. But the thousands of patients that are dying are brothers and sisters and children and parents of families, often breadwinners. And so it has devastating effects on many families. The majority will be fine. But unfortunately, how the majority behaves is going to impact on many, many families and livelihoods.
Thank you very much for speaking to us, and thanks to you and your colleagues and all frontline healthcare workers for the amazing work you do. Dr. Richard van Zyl-Smit is a pulmonologist working in the COVID-19 ICU wards at Groote Schuur Hospital.